Just so you guys know, I'm pretty sure when these off-island hires come to Guam, they're like, hey, anything I should know before I get there? Yeah, you should know how to cha-cha. 7:51. Hey, we're having Lieutenant Governor Josh Tenorio on the show. We have that weekly commitment, and he did commit yesterday to call in around 8:15. So if you're looking to hear from the Lieutenant Governor of Guam, keep it where you got it. It's containing COVID. Let's go over to the phones and keep it with the doctor. So a medical doctor here from Public Health, Dr. Janna Manglona. Good morning, Doc.
Good morning. Can I tell you about cha-cha? I've gained so much weight in quarantine that when I walk, it looks like I'm cha-chaing. It's not funny.
It's not. Well, I can laugh because I feel attacked. Doc,
Good morning.
You guys are all the way in Inarajan today for community testing, right?
You got it. At the Southern Region Community Health Center. And I want to emphasize there's been a little bit of a twist. The testing now, no symptoms are needed. I think when we first started, we were looking for some symptoms, but now nothing. If you want to show up and be tested, please show up. And that way we can tell how much disease that we have out in the community, and we've been lucky because it looks like everything's looking pretty good in Guam. Mm-hmm. We'll be at Inarajan today, tomorrow at Mong Church, then on the 11th at the Marito Senior Center, next week the 16th at PT Mayor Office, 17th Santa Rita Senior Center, the 18th at Tamuning St. Anthony Church, 23rd at Barragata Community Center, and the 24th at the Agana Mayor. So it's quite an island sweep.
And it's pretty interesting because it does seem like people are coming out and getting tested. I've been seeing the numbers. So it's a really good thing and good job to you guys.
We can't say anything about who's coming out because of HIPAA, but on that note, I haven't seen your all's names.
I know, right?
Yeah.
I was actually supposed to go last week, but then I had a meeting here that I couldn't get away from.
Yeah, you were having cough, fever, and shortness of breath and couldn't go.
Mostly just loss of taste.
Oh, it's just the smell that bugs us. But no, I'm joking. It was total bluff. So you didn't get tested, huh? You guys need to get out and get tested.
Yes, I'm gonna make it a point to do that.
Doc, I actually got my swab up my nostril for some B-roll. I want to say this is
early on,
early on with American Medical Center and Dr. Akimoto, and man, that thing, I almost cried.
They say it's not real comfortable, so I wish you wouldn't advertise that. I heard it feels really good.
It actually tickles, yeah.
Yes, really, yeah. Yep. And you get a sticker.
If you ever had anyone
and a lollipop.
If you ever had anyone kiss your ear, that's how it feels. That should get you a couple dozen.
I want to know who's kissing your ear.
Hey, Doc. So yeah, people are coming out, and I know you've been at the last couple. What are they saying? Because you're right. This is a kind of a new criteria. Before it was like you had to have all these symptoms, and now it's just open to everybody. So what are they saying?
People are just curious. Even if they had no symptoms, it's just natural. I did a test. Did I ever have any symptoms? No. I didn't do the swab. I did the bogus test, basically the serology. I think everyone's curious because we know that some people are asymptomatic and carrying it, and we know some people have a really mild go of it. So they just want to check whether they had anything or not. So this is good for everyone. And if you aren't from that area and you would like to go navigate down there and get tested, that's okay too. We'll take anyone who shows up. Plenty of tests out there, and it's good to get everyone checked. I haven't heard any rumors about being tested. Like I've heard people say when you get a biopsy of a lung cancer, it spreads everywhere. I haven't heard any rumors like if they're going to catch it off the swab or anything like that. But just in case, the swabs are all clean, everyone gets their own, they're not reused, and there's no way for you to get it from any of the procedure that occurs. So, needn't be afraid. It isn't the most comfortable thing because it makes you want to sneeze or cough or whatever.
Yeah, and let's be real. That's about is it comfortable? Does it feel good? No, but it's not childbirth or anything.
I've had more complaints over swabs elsewhere than there.
It's like someone was complaining to me about, I got to go to the mall. They got to check my temperature. I'm like, hey, at least it's not the rectal thermometer. You got to look at the bright side, guys.
Oh my goodness.
Okay.
At least they didn't confuse the thermometers. That's the wrong one.
Yeah.
Doc, with the results that we're seeing a lot of zeros here, we've got the public health emergency. It's in effect until June 30th, I think. If we stay on this track, are you looking at the possibility that we might go into peak or 3?
I think there's chatter about it, because obviously that's what we're all looking for, and we have to look forward, because all good things have to end. Even bad things have to end. But I think that's what everyone's looking forward to, and they talk about a second wave, and I think some people think the second wave is that it's going to hit us again. It's going to come back and sweep through like the typhoon, reversing its track and coming back through. It's not that. It's that now as we sort of come out of our holes and lift the lid and peek to see what's out there, we're expecting some to sort of creep back in. And it's going to be like balancing a ship on a wave. You give a little and then you see where you are, give a little, see where you are, and try to just keep it balanced. And if at some point everything is in place, if we open up a little and it starts to flare again because we let some of it in, then we'll back off a little, and it'll be a delicate dance. That's why when someone says, "Do you think I can go on this trip on July 1st?" Tell me what's happening June 30th, and I'll answer that question. It's really a day-to-day thing, even since the inception of this. It's how we react to it, what kind of testing we do, everything. It's just day to day. And we're all walking through this together. It's hard to find anyone with answers, because when you ask the question, they're like, we were wondering that too. But we're all going through it together, and Guam as a whole has done great. We have these little hiccups here and there, but overall the impact has been wonderful, because it hasn't caused any kerfluffle with the numbers or anything like that. And so we're looking at now to start letting people come in, and certain groups get to go to home quarantine. And if they're from what they call a hotspot area where the cases are just soaring, and we have numbers for this, then of course those people will still require quarantine, because of all the things we've done, quarantine has been the most effective.
Right, yeah. Doc, let me cut in here. We're KUAM FM, Agatni Guam. It's Containing COVID, the KUAM News takeover of Guam's favorite. Good morning to our viewers on KUAM TV 11. On the line now, we have the Medical Director for Public Health, Dr. Janna Manglona, and we're currently discussing quarantine protocols for travelers who are returning or coming into Guam from hotspots. And Doc, I wanted to ask, is the United States listed as a hotspot? Because people keep asking me, hey, well, the U.S. is at a crazy spike the last few days.
Right. What we're looking at is the overall trend. There's a formula. This is coming out of the Physicians Advisory Group, not Public Health.
She's like, not involved. That's the Physicians Advisory Group.
Yes, I'm in both, so I'm wearing both hats.
Okay.
But this Public Health, overall, they're like the governor, and the Public Health is married to the governor, and so everyone tosses out these plans and these formulas, and then they look at it, and some they accept, some they reject, and some they want a little more information. So we keep on meeting every week, several times a week, and we go, how about this? Is this palatable? Does it look doable? And the heads of everything look at our infrastructure, how are we doing on the hospital, how are we doing with our test kits, and they look at the whole thing to see if it would work, if it's a good fit. And so the formulas that the PAG group is using, we look at doubling rates, and in certain areas where the number of cases, if you go from 10 to 20 in a certain amount of time, then you would be a hot spot. If you go from 10 to 20 in 60 days, who cares? If you go 10 to 20 overnight, everyone cares. So we look at the doubling rates, and doubling in the illness, not in the death. And if it fluctuates every day, so someone may not be a hot spot today and they are tomorrow. So that's the formula we're using, because we had to put a number to it because everyone is concerned about where people are coming from. If you visited there or if you live there and you're coming here, it's not about Guam, it's where you're coming from. Then it becomes Guam's issue after you land here.
Right.
So we got to know where you're coming from.
That being said, Doc, what do you make of these? I think there was one yesterday and another June 3rd. These people coming from Guam, flying into Saipan and popping positive for COVID-19.
Well, I think last I heard, Saipan is still quarantining at the PIC, aren't they? 14 days?
Yeah.
I think that even if you come in with a negative test. And now, for a long time we said a negative test doesn't mean much because you can be actually positive and it doesn't register for a few more days. Well, now we're finding positive tests after a period of time may not mean much either. And so you can't just take the test now and look at it just in your hand like a pregnancy test. You have to look at it in the context. Like, you might walk in and test positive. I walk in and test positive. I end up in the hospital, and everyone yawns when you come in positive because it's old news. Maybe you were positive 2 months ago, and it's just, as you put it, crumbs. I keep quoting you. I give you no credit for it except on your show because I like that. I'm so noble. But anyway, so it just depends now, because as this thing evolves, we're finding that people do still test positive way out. And so it's positive, but what then? What's the story? You have to know the backstory on all this now, because it's been around a while. So a positive in March meant a whole lot more than a positive means now when someone's just shopping for eggs at the grocery store. So I don't know. There's so much to be learned about this virus. But
still, even now.
Yeah, even now. But hey, we even though we don't know, we've done what we can to mitigate it, and Guam has done great. I think Vietnam has had no deaths and they've held their numbers down, but I don't know many areas that are better than Guam. The community as a whole has just been stellar. And then you've got the people, now that we've shut down, you've got people that come back and go, see, it wasn't that bad.
Right.
It's like someone says, hey, there's a missile coming in, duck down. You duck down and the missile doesn't hit you. You go, see, what was the point in ducking down? It didn't hit me. And you're like, okay, where do I start? Who ties your shoes in the morning? Yeah. but we dodged some bullets, and I'm not embarrassed about that.
Of course.
Doc, are you involved with this pilot project with the children, with the Japanese school and other smaller institutions of learning?
There's a subgroup from the PAG group that's doing that, and Dr. Michael Ohm is involved, and Dr. Berg, a lot of people from our little group,
right.
And so I'm hearing it's our attempt at slowly opening the door and tiptoeing out the door to see if the typhoon's passed. We're trying to do everything in baby steps,
right?
And that's just part of the baby step as far as schooling, because the goal is to get everything to Core 3. Core 3 will be almost life as we knew it before, except social distancing and masks are probably here to stay for quite a while,
right.
If not forever.
Doc, I guess a last question, because we gotta take care of some business here. And
another half an hour, I'm good.
Okay, well, I mean, I'm good too, but
me too.
So, the last wave of businesses that, well, at least what I was thinking is, we've opened the gyms, we opened the food courts, the small
right.
schools are doing a study.
Right.
I'm just wondering if you have heard anything, or if you could tell us why we haven't discussed the opening of movie theaters and bars and lounges, because we've opened restaurants for dine-in, and some of these restaurants have the bars in them. So I was just wondering, is there a public health reason for this?
I don't think so. I think it's just part of the step by step, and we've got to. We're doing really essential places first as much as we can, and then we're getting to the less essential. But we've got to be able to, I don't want to say police it, but we've got to be able to deal with, if we open to everything, we're going to be getting calls right and left. You know, this place has a group here, and, you know, we're trying to do it little by little. I don't, there is no how-to manual on this.
Okay. I thought there was a reason, like...
No big reason.
Okay.
But those are great cluster places, and we've been asked about bingo, and it's just difficult to space at certain places, and so we're doing that little by little. But there was no sweeping reason for that.
I see. Okay. Yeah, you're right. Happy hour from 6 feet away.
Exactly. You know, if you go there to hook up, it's going to be difficult. No, you're going to be yelling across the bar going, "Did you get my text? Hey, babe, did you get my text?"
No, I'm good. I'm getting my ear kissed.
And it hurts.
Okay, Doc, we got to go.
Always a pleasure.
Yep.
All mine.
I got your new picture up, by the way.
Oh, did you?
Yeah.
Selfie of Kim Kardashian.
Yeah, pretty. Yep,
Looking
pretty Kimmy.
hot.
It's all it's au natural.
That's got to be pre-COVID hair, though.
Oh my gosh. Okay.
Thanks, Doc. Okay, wash your hands.
Talk to you soon.
All right.
Okay.
Bye.
Okay, thanks.
Okay, there you go.
I love her.
Yeah, Dr. Manglona of Public Health. Really just an awesome lady. Hey, we're going to take a break. Again, the show. Thank you for joining us on KUAM TV 11. There's so many ways. Here's an audio feed. Docomo Channel 10. We're streaming live.
To hook up. Oh, wow.
At KUAM.com. I just wanted to ask about the bars and the theaters, because they're like the last thing of things that haven't opened yet. 809. Again, you can catch us on KUAM TV 11 and also on the Edward R. Murrow Award-winning social media networks of KUAM. We're going to take a short break. Coming back with the Lieutenant Governor of Guam, Lieutenant Governor Josh Tenorio, next on Containing COVID, which is all proudly brought to you by Ambrose Inc., Coast 360, the Bank of Guam, Calvo Enterprises, and IT&E, with a special thanks going out to CS.
Oh, yes.
Yes. Where's our...
Right here. It's so good. Thanks, Milk.
Yeah.